Welcome back at 9:15. Nearly half of all American adults have high blood pressure, but only 1 in 4 adults with the condition has it under control. Dr. Sarah Schwertner with Primary Care Plus joins us to offer tips on keeping our pressure low. Thanks for being here. Good to see you.
Thanks for having me on the show.
Let's start with the basics. What is blood pressure? High blood pressure specifically.
Okay, so blood pressure is basically the force that your heart pushes against your blood vessels to get the blood out, and also how your heart relaxes. So you have systolic, which is that top number, and that is the force against the vessels, and then you have diastolic, which is the force that your heart relaxes. So it's very important that we like to keep it under control.
And that's how it's measured when you go to the doctor, or whether you're just going to the the store and you're getting your blood pressure checked. That's how it's measured.
Yes, so systolic's top number, diastolic's the bottom number.
What's a good range for healthy versus something that's maybe more of a concern?
So, the normal blood pressure is going to be 120/80, and that's where we kind of like it. Now, when you start getting up to over 140/90, then we start thinking about, okay, we need to get this under control.
Let's talk about that. How do you get it under control? Are there symptoms, or how do you know that maybe there's a problem going on without, taking the blood pressure and seeing those numbers?
So high blood pressure is called the silent killer. If you don't have it under control, then you can have things like stroke, heart attack, things like that. And so you really want to go to the doctor and get it checked at least once a year.
Yeah, that's good to know. Like you said, that's a good risk factors. You were saying if you don't know what it is, maybe just check in with your doctor. You might be having an unhealthy diet, things like that, to kind of help you get a control over it. What are some things that we could do to get control and maybe prevent high blood pressure?
So in Louisiana, everybody likes to indulge in all the delicious foods. But unfortunately, if you eat a high salt diet, you have the risk of having high blood pressure. Also, you want to make sure that you keep your salt low. You want to make sure you exercise. You want to make sure that you don't smoke. You want to make sure you keep your stress level under control. And those can help with controlling your blood pressure.
I guess the opposite of that would be those who would be at risk for high blood pressure?
So the people at risk, if you have high blood pressure in your family, then you're more likely to have high blood pressure. So mom, dad, brother, sister, grandma, grandpa. Another risk is being overweight, not being active, and not having a low salt diet.
And what are some ways that we could maybe, I know you could take medications for high blood pressure, but what are some other ways that it can be treated?
So exercise at least, I always tell my patients at least 4 to 5 days, 30 minutes of cardio, where you really want to get your heart rate up to the 80th percentile for your age. Okay. So that's it's an excellent way to decrease your blood pressure.
Good, and kind of keep mind of that. I know stress can be a factor when it comes to your blood pressure. I know that's something that I heard a lot growing up from my mom. You were stressing me out, making my blood pressure spike when we were kids. So I guess, sorry, Mom. So I guess that's something that also people can kind of help control their stress, maybe meditate, yoga, walking.
Yes. So decreasing your stress levels, try to find what is causing the stress and getting it out of your life.
I know you're a mother too, and you're going on a trip with some teenagers. You were just saying.
Yes. So I said, pray my blood pressure doesn't go up this weekend.
I think you'll be fine. It's a nice, relaxing area where y'all are going. Thank you so much for being here. Any other helpful tips that we need to know before I let you go about high blood pressure? Just
make sure you get it checked once a year and try to do the right thing to get it lowered if it is high. So eat a healthy diet, exercise, decrease your stress.
Just get it checked. Dr. Schwertner, thank you so much for being here. Good to see you.
Thank you for having me on the show.